Hi guys, it's Dr. Tucker, and if you've got ankle pain, you might want to spend a minute listening to a few things here because quite often we'll see people who come in with some degree of ankle pain, stiffness, some need or want to kind of get it to pop or release, and sometimes they just feel it even like limits the way they walk or they favor it. Quite often as a chiropractor, when we see the patient lay down, instead of level, we'll see some possible inversion or some malpositioning of the one foot relative to the other when we look at it. So how does this happen? What can we do about it? So first, it doesn't always happen as an acute injury. Someone can start walking funny and getting these weird compensations years later because they could have sprained their ankle pretty badly at one point, dealt with the pain, healed from the pain, and then kind of forgot about it. Now, what is an ankle sprain? An ankle sprain is where you might have a connective tissue that connects bone to bone overstretch. Maybe you rolled your ankle on an unlevel surface, a curb, a hill, running on something uneven. So once you actually have a ligament sprain, by definition now, there's a misalignment because the ligament had some laxity and overstretched. So the two connecting bones in the ankle had to have shifted. So once the inflammation settles from an ankle sprain, the second thing you should look for is how to realign and reintroduce good mechanics to the ankle. As a chiropractor, we'll poke around the different parts of the ankle, and if we feel a joint not moving well, there's some restriction, our job is going to be to mechanically free that up so it can start gliding better. Because if you don't free up that ankle restriction, over time a couple things are going to happen. One, you're going to start to lead to arthritic issues. Two, you're not going to have that proper heel strike or the proper motion in the ankle, and in turn, something else is going to be compensating. So mechanically, if you're favoring your right ankle every time you step, maybe now your right knee, maybe now your right hip, maybe something in the low back or pelvis is going to pick up the workload for the ankle restriction, causing more wear and tear up the kinetic chain. And more so, the brain neurologically sends these signals for proprioception. And it's basically like these little receptors that give you awareness of your environment. And if there's poor signals in that communication pattern from the brain down to the ankle and back, we're going to try to reintroduce a motion that'll wake up those nerve receptors. And by doing so, quite often you'll see the kinetic chain start to fire better. And ultimately, in the long run, if you can improve where the original injury was, where the original dysfunction, the root cause was, you'll stop and arrest further spinal decay, further knee decay, address these or prevent these future degenerative patterns in other injury sites, those compensatory regions. So if you feel something's out of alignment, something's altering your gait, that's a perfect time to have a chiropractic checkup. Any questions, just leave us a comment below. Thanks.